Welcome back. And remember our signature, if we had a brand, this is our brand. It's 1 degree course correction. Nothing happens quickly. But then you didn't get here quickly. It took a long time to get here. But if we move slowly, we can move in another direction slowly over time.
Okay, so we want to talk about what we're doing here as a journey. It's, our brand there is a map, and our title slide is actually an airplane going somewhere. So we hope that we're going somewhere, but it's a journey in time. It's a journey to a future that hopefully is going to be different than the past, because there's things in the past that are not working. So we're trying to find ways to have a future, to journey into a future that's a little bit different, and hopefully quality of experience is better than you've had before. Now, sometimes that journey can feel like a strange one, and often it's a very slow journey. But again, as Bill just mentioned, you didn't get where you are quickly for most of you. Maybe some of you did, but usually anything that's going to be sustainable, any kind of change that's going to be sustainable over time, improving your quality of experience is going to be a slow, and sometimes not only slow, but sometimes it feels like 1 step forward, 2 steps back. So I like the idea of the camel in the sand, because I don't know if you've ever had that experience where you're walking in sand and it feels like you're taking a step, but you're kind of slipping backwards. And it's often something that our perception tells us that it's 1 step forward and 2 steps back, which means you're not making progress. But usually it's 2 steps forward and 1 step back. So even though you are maybe sliding back, and it's very seldom linear, but you probably are making progress even though you might not realize it. Again, the idea that 1 degree course correction doesn't seem like a lot, but if you can sustain that over time, it can make a huge difference in where you arrive. Now, the journey can also be confusing, and that's what we wanted to address right from the beginning. There are so many possibilities. There's so many different things that you could do. And how do you decide what's going to be working for you? You have someone who says, oh, do this. This has just been wonderful. It's the best thing I ever did. And you try it, and it's terrible. And so there's not one clear journey. It's very individual. Every person has their own journey to connect to. And what we mentioned was, this is about really learning to tune into yourself, really learning to start trusting yourself, your own intuition. But what we're here to do is help you to find tools that will help you to make the right decisions for yourself in terms of what road to take. And so because there are so many choices, people want to support, they want to help, they want to give you guidance in so many different ways, but you'll notice on this picture, there's one guy on a bicycle going down one road. There's one person walking, going down a different road. And so again, it's just a matter of how do you choose. We talked about essence and form, and the idea that the essence here is we want to find a strategy that will enhance well-being. So the essence is enhanced well-being. And all the different roads to that are different strategies. It could be slow breathing, mindfulness, meditation, exercise, sleep is important. And we're going to talk about CBT today. Now, sometimes not only does that journey seem confusing and slow, often it feels bleak and it feels lonely. And so one of the things in the toolbox that we talked about was gathering support, finding people to support you on your journey. And actually, this also means supporting other people, which sometimes can also be supportive. But we talked about it's not simple, because sometimes people who truly want to support you do things that are not supportive. And it's not a given when people offer support that it actually is supportive. So how do you navigate that? How do you find people who actually really do support you? And on the questionnaire, one of the questions was, some of you chose to connect with other people in this classroom, because one of the things that has become apparent is that people who have a similar background sometimes are in a better position to support you than people in your family or circle of friends who might truly have wonderful intentions but simply don't understand what you're going through.
Curiously, the number one thing I can't write a prescription for. The most important single thing is support systems, support networks. Men who are married live longer than men who are not married. I mean, this happens. It's a social network that prolongs your life, that allows you to cope with situations. So the one thing I can't write with my hand is social networks. So we cannot overestimate or underestimate the importance of social networks. We use complex words to describe something which is cognitive behavioral therapy. I have a medical degree. I have a master's degree in counseling psychology. I've taught this course multiple times. I practice it. And I have trouble understanding what cognitive behavioral therapy is. So I said to myself, how can we be clear we know what it is we're talking about? This gentleman's question about enrolling support speaks to a belief system. That's a thought. That's where it begins. It's a challenge that you have is where it begins. It's actually, by the end of this course, I hope we all understand what we mean by this funny word. And basically, it's about changing the way you think. Not making wrong how you think, but accepting what it is and trying to shift it so that your experience shifts. And it works both ways. So it's changing the way you think, changes how you feel and behave, and changing the way you feel and behave changes the way you think. And it's not just about positive thinking. I'm going to go out there and think positively. No. There's nothing wrong with your thought. It's not a negative thought. It's what it is. And you want to evaluate it and see if you can take it in another direction. So remember our toolbox. This is where we're going to come to finding out what you did over the last month. You might have done CBT. You might have done some mindfulness, yoga, breathing stuff. And we're going to see how that goes. This is a quick reminder of what I told you about last time. The whole of the mindfulness meditation movement was developed by Jon Kabat-Zinn. And he's written about the use of these techniques in pain management. And I gave you a brief history of how these systems developed. CBT followed through these authors, quite modern, 1950, 1960, 1970. So it's a relatively new concept within the psychology world. The whole area of mindfulness, meditation, slow breathing is ancient, like ancient, and it's been modified and brought up to date by Kabat-Zinn. So the question then comes up, we seem to have two competing systems. No, we don't. They're not competing. They have distant histories, but we are now in the present, and we've inherited them both. I've got a mother and a father. I got them both. They come from different histories. And CBT, we're going to try to teach you what it is by attending this course and learning about the boxes within the toolbox. And mindfulness, meditation, mindfulness, slow breathing is about autogenic training. Senta told you last time that, or the time before, that autogenic means automatic. It's repeat, 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 repeat. So they're different structures. So CBT is about changing thinking and behaviors, and meditation, mindfulness, and slow breathing is about repetition, repetition, repetition. They say there's short-term memory and long-term memory. Short-term memory is to remember. And long-term memory is repeat to remember. That's beside it,
So for CBT, often what's recommended is a minimum of 6 to 12 weeks. And usually there's some kind of shift that can happen. And then you can do it again and do it again. There's sort of levels of CBT that you can continue on with. But meditation, mindfulness, and slow breathing are things that you can continue on for your lifetime. And this is where you get into the idea of habit. And it's interesting, habit, the word habit. I sometimes like to talk about the fact that words have sort of an energy charge. And sometimes the word habit can actually have a negative charge for some people, because some people have habits that are detrimental. But habit can also be positive. And it takes discipline and it takes repetition. And there's been research that says 18 repetitions will result in a certain behavior becoming a habit. And so what we're hoping is that you're going to find something that is helpful to you, that you repeat often enough that it starts to become a habit. And so, interestingly enough, cognitive behavioral therapy, when you think about cognitive, what we're talking about here is thinking, and we're thinking about choices and decisions. And guess what? Making decisions, making choices takes energy. And more for some, I tend to be the kind of person that takes a long time to make a choice. I have to consider all the possibilities before I make a choice. Some people make choices more quickly. But regardless, making a choice, making a decision takes energy. So evolutionarily, the reason that we have the whole concept of habit is that once you become repetitive about a particular choice that you've made, and you do it enough that it becomes a habit, then you don't need to use the energy that it requires to make a decision every time. Okay, should I do that exercise again? It's like brushing your teeth. You get up and you brush your teeth. You don't think of, well, am I going to brush my teeth today? Probably I am. So it's something that actually saves and conserves your energy. But basically what you're doing is making something that you've finally come to a choice, made a decision about, and you've used cognitive energy to get to that place. You're making it something that's more stable, that you can depend on. So again, we talked right from the beginning, there are so many choices. And how do you decide? There's so many roads that you can take. And so CBT is actually a tool that will help you. And we're going to talk about the self-empathy process that we went through in an earlier class. And I'll show you that picture again, where basically often what CBT will do is it gives you clarity. It helps. It's very difficult to make a decision when you're feeling overwhelmed and confused. And it takes cognitive energy to get that kind of clarity. But what you want is, okay, how do I decide? Do I want meditation? Do I want slow breathing? Or do I want all three? Or maybe two of the three? How do we make those kinds of decisions? So as Bill was saying, we need both. We need cognitive behavioral therapy as that node that helps us decide what habit is going to be helpful to us. So CBT, we make the decision, and then the autogenic path that we choose becomes a discipline or a habit. And Bill is going to talk about even that habit, that memory, is more than just in the brain. You're going to go back to, there's memory. Let me show
I think it comes later. Right?
No, it was in that slide. Right. Next one. That one.
Yes. If I asked you to tell me where in the body do we have our memory organ, what would you say? Where in the brain do we hold? Where is memory retained in the body? The brain. It's the animal with the best memory is the elephant. But in the human, it's the hippocampus. That's where we keep our memory. So we have a hippocampus, not an elephant campus. We have a hippocampus in our brain where memory is retained. But how many of you have been immunized against anything? Every one of you. Now, what's the purpose of immunization? It's to prevent a disease, a viral disease or some disease affecting you at a later date, right? So if you're inoculated against whooping cough, measles, smallpox, polio, all these things, you get 1 or 2 injections at the beginning, right? Usually when you're a child, And for the rest of your life, you'll never get that disease. Why? You'll never get that disease because your immune system remembers that signal. So if you do get exposed, why do you take flu virus? How many of you got a flu vaccine this winter? Why did you take it? You took it hoping that the flu that's currently the biggest flu, well, you won't get it. Then, of course, another sister flu comes by and you get sick and you say the flu vaccine didn't work. That flu vaccine prevented you from getting the flu that it was intended to stop you getting. And that's not anything to do with the hippocampus. The hippocampus doesn't even know about it or care. It's your immune system. So our immune system is an amazing memory system. Now, one of the things that will blow your minds, I've already tipped it off previously, is that autogenic training and CBT, yes, it does work through the hippocampus, remember, not the elephant campus, but it also trains the immune system. Now, as you calm the immune system, it's tightly related to the endocrine system. So they've done studies. I told you this before, I'm going to tell you again. There was a study done on ladies with end-stage breast cancer, and they divided them into two groups. One came for regular weekly sessions, and the other just got standard care, as did the others. And within 12 weeks, the group that came regularly had higher circulating immune cells and lower circulating blood cortisol, the stress hormone. That's all they did. They came once a week. And then what was amazing is for the rest of their lives, that thing held. It held because their immune system remembered the training. And that immune system enhanced itself, and the cortisol levels, the stress hormones came down. And the population of women who had end-stage cancer, when they entered the trial, lived for 36 months longer than the group that didn't. So we have an incredibly important immune system memory system. And that it triggers the endocrine system. So these are the memory systems. And now, what we now know is that CBT plus mindfulness, meditation, breathing, what we're going to call autogenic training, if you can do it long enough, it has been shown that your immune system will respond. And your cortisone system will respond. It's been proven. It's not fake. There's publications for that. Now, you might be interested to know, I came across this article while I was reading in the last month, and I found it mind-blowing to me, so I thought I'd share it with you. This is a publication from 2006, and they compared the effect of antidepressant medications versus CBT. And they did large clinical trials, and they looked at irritable bowel syndrome, fibromyalgia, chronic fatigue syndrome, back pain, and headache. Now, how many of you in this room can relate to those 5 conditions? How many of you in this room have been offered or have tried amitriptyline? How many of this room have tried Prozac or Zoloft or any of that category of drugs? How many of this room have been tried on Effexor or Cymbalta? All of those drugs have effectiveness. They have proven effectiveness in certain circumstances. Look at the evidence. Look at the evidence. For irritable bowel syndrome, CBT is as effective as amitriptyline and more effective than those. And this is not effective at all. Look at fibromyalgia. Amitriptyline is as effective as CBT, and it's as effective as Effexor. It doesn't mean that everybody benefits, but it's as beneficial. Look at chronic fatigue syndrome. The drugs don't do any good. CBT does something for the patients who have chronic fatigue syndrome. Look at back pain. This is a complex topic. There are literally 150 causes for low back pain. This is not a simple complex, but you'll see that CBT is as effective as the drugs or more. Now, headache is very complex, and this isn't really a very fair study because there's migraine headache, there's headaches from neck issues, there's tension headaches, it's a very hard one to get your mind around. But you'll notice here that CBT is consistently helpful across the spectrum of these conditions. You'll see that CBT doesn't affect any of your medications. Whenever you get put on another medication, your physicians has to balance what are you doing for, how am I affecting the interaction between existing medications, and how do they get metabolized, and so on and so on. And CBT is recommended as a form of treatment for all of these conditions. So I thought you might find that interesting.
Yeah, and the reason is because often when we speak from a place of we're at the end of our rope, and we haven't really, we can't be even really rational more than, be clear. And so what is helpful about this process is it gives you clarity. And from that clarity, quite honestly, clarity is much easier to hear than what happens when you are so triggered that you just say all kinds of things, half of which you don't even really mean. It just, how we've been socialized to express. So when you look at this, it looks like a jumbled mess, right? Because that's often how we feel. We feel confused. There's all kinds of thoughts and feelings. It would be nice if we had even just one feeling at a time, but rarely does that happen. We have more than one feeling. We have multiple feelings, and they compete with each other. We have multiple thoughts going through our head at the same time. What I would like to point out is, for me, the most important part of this process is, what am I telling myself? In fact, that phrase can be helpful just in and of itself. When you say to yourself, what am I telling myself? You remember, this is a story I'm telling myself. Someone else could be telling themselves a different story, and they would have a different perception. So it's about perception. It's not reality per se. And even that, so what I like about this is if you can connect at whatever place in it you connect with, it can be helpful. It can be that 1 degree course correction, and the more of it that you can relate to, the better. Now you remember it was about cleaning the bathroom. And for her, the thought, what she was telling herself, is it's always going to be this way. He doesn't care. He just doesn't get it. I should be able to do this myself, but I'm feeling pain. I can't do it. So her needs, and there's other sheets out there that talk about feelings and talk about the triggering event, but they don't talk about needs. And for me, needs are the bedrock. If you can anchor what you're feeling to needs, that's when you're going to shift. That's when the clarity will come. That's when you're going to understand why you are so activated, because needs are something that all of us can relate to, and you understand why those needs are so important to you. So yeah, you have feelings of pain, but you're feeling discouraged and stressed. But the need you have is for reliability, for consideration, for teamwork. When you express that, people are much more likely to hear that than a specific thing about a specific trigger. The no wonder statement, what I love about the 2 words no wonder, what no wonder does is it gives you that space and it gives you permission to feel, because we are so conditioned to not feel. You shouldn't feel that way. It's just a little detail. It's just the bathroom. It's how come you're so upset? What this does is, no wonder I feel this way. Of course I feel this way. Any normal person would feel this way, because consideration, reliability, and teamwork are really important values that I'm really aligned with. So it helps you to connect with yourself. It helps you, as this process is called, give yourself empathy and consideration and understanding. And from that place, you get to a place of clarity where then you can express, and you're much more likely to have the kind of results that you would like. So the self-empathy statement, no wonder, helps you to connect with yourself. And then one of the magical things about this process, if you can get to that place, is your imagination. Because Einstein tells us that imagination is more powerful than intellect, because it can take you places you've never even been. So when you imagine your needs to be safe, to have respect, to have consideration and teamwork, over the top, totally met, how do you feel? So this is the pivot. This is how, in terms of CBT, often they'll say, just change how you think and you'll change how you behave. But there's a whole lot in between those two. And what I think is between them is allowing yourself that space to have feelings and recognize the needs that are important to you. And give yourself empathy for that. You're much more likely to have a shift that makes sense and that actually will take you a place you want to go, if that's the case. So CBT, it's basically, I feel like feelings and needs are the pivot that you need to get to the behaviors. It's like a lens. You look through a lens of need to get to a different place. So you have that triggering event. You go through that lens of feelings and needs, which is a CBT lens, and then you can come out with, from a place of clarity, come out with a different behavior. Does that make sense to people? I know this is repetition. We did go over this before, but any questions about this? Okay, so again, changing your thoughts, change behavior, and your thoughts start changing. You start perceiving things differently. You start telling yourself a different story. You start telling yourself a different story about overburdening people when you tell them what you're thinking and what's going on for you. So again, this is a CBT tool. This is something you have. You can download it. You can print it out. I love to hear that you went and got your sheet and filled it out. Even just saying time out, saying to someone in the heat of an interaction, this is important to me, and it's important that I say what I really mean, so I need to take a time out. I need to take a break, but I will come back. I need to work this through. And then when you come back, you've got a clarity of expression that you never would have had before. So this is just a tool, but it can be a really powerful one that focuses on thoughts, but also on your needs and feelings.
This is a tool that is available on a website I'm going to give you some information on. Now, this is the typical tool that therapists give to patients or clients. This is the tool that comes from a lot of the pain groups, and you'll see that this tool focuses on thoughts and feelings. But you'll see at the top left, what they do is they say, what happened? In other words, what was the triggering moment? What was that falling in the hole moment? When was that moment that you flipped your lid? What are your thoughts? We agree with that. And then they say, how do you feel? So they've gone from thoughts to feelings, but they're missing needs, which is what Mary Ellen adds. Now, you might notice that the thoughts are often negative, and you might notice that the feelings are negative. But by using Mary Ellen's tool, you're putting needs, so you're adding a positive in between. And so then you can move on down the list. So what Mary Ellen's tool does is the same as the other tool, but it adds needs. And as she said, needs are the bedrock of this process. So this is your CBT tool. Getting back to the question as to what can I prescribe for the chronic pain patient, the first thing I can't prescribe with my pen is social support. More important than anything I can prescribe is social support. More important than anything I can prescribe is better sleep habits. And thirdly, more important than anything I can prescribe is knowledge about pain. The more you know and understand about pain mechanisms, about what's going on, the better you will be able to manage pain. So here we are, the third thing that I can't do with my prescription pad, knowledge about pain. I want specifically to recognize this lady, Sandra Lafort. She's a professor of nursing in Newfoundland. And she is the Canadian guru, the first Canadian to really put self-management programs on the map. And the reason why self-management programs are important is you are your own best treater of your pain. How you self-manage is important. And she's published a lot. And this is just a reference to one of her early works, and I do this to acknowledge her as the Canadian leader in self-management programs. This is the best resource I can give you for self-management. And I want you to see who the authors of this website are. Sandra is one of the key authors of this organization. The bottom one down there, this is a larger version of it, is actually very important as well, because the University of Victoria have developed self-help programs, and there's a website on that, so you can contact them, and they run programs all over BC. They hold them regularly in Kelowna, and I have referred several of my patients to these programs. They're run by lay people who are trained to do the work. And it's also available for free, and they come here 3 or 4 times a year, and they run programs in this community, and I strongly recommend them. So that brings us to the importance of education. And when we started this program, we told you that our primary motive in coming and holding it together was to help you provide education. This is an education program about knowledge. If we can help you along the way, by pointing along the way, it's about augmenting what's already out there. Some people said they've come to learn things they've already read about. That's good. If we can help reinforce what you already know, good. And that brings me to this slide. Now,
This is not CBT, by the way.
Marilyn says this is not about CBT, but it is about thinking. Some people say this is an illegal product. Or, my child smokes too much pot. Or, these are all belief systems, right? It doesn't work. It does work. It doesn't work. I get it from my neighbor. My son's been urging me to use this thing for a long time. So it is about thoughts, and it very much has to do with pain. There's a cognitive behavioral piece in here. So are any of you interested in hearing more about the plant? I won't ask if you're using it, so let me ask you this. Do you know somebody who is using it and wants to use it? There's a publication the other day in that famous journal called the Kelowna Daily Courier. Have you ever heard about that? There was a study done at UBCO, and there's a statement that patients would prefer to use products from this plant than narcotics. And I agree with them. I'm on record for agreeing with them. So I'm going to give you a very quick history. Now, we call these things cannabinoids. The OID applies to what you get from, like opioids come from opium, and cannabinoids come from cannabis. But how many of you honestly know that there are human cannabinoids? Put your hand up. How many of you know there are plant cannabinoids? You all know. But what's most fascinating, and we were talking about the move, we're moving now from organ system specialization to molecular medicine. And this is the corner of where we're going to molecular medicine. You know why? Because we are living cannabis plants. I'll say it again in a different way. Let me say it again in a different way. You see, why do we call it cannabinoids? Because some biologist many, many years ago called this a cannabis plant. They called that a peach plant. They called that an ash plant. They called that a rose bush. So botanists give names to plants, right? But we've known for 3,000 to 5,000 years that there's something in the cannabis plant that does something to people. We've known that for 5,000 years. We've known for 5,000 years that if you take poppies, which have the root of heroin, it does something for you. So we've known about it for a long time, but you'd be amazed to know that we have a human endocannabinoid system. And it's an animal cannabinoid system that has existed for over 400 million years. ever since vertebrates emerged, the dinosaurs had an endocannabinoid system. Get your mind around that. Now, watch this. Watch this. This is going to, it blows my mind, so I'm just assuming it might blow your mind. We've known for 5,000 years that something in the cannabis plant was psychoactive. In 1963, which wasn't very long ago, they found in the cannabis plant a substance called cannabidiol, CBD. A year later, they found THC, tetrahydrocannabidiol. And they discovered that it was the THC that was the psychoactive thing. So they only discovered in 1964 what people have known for 5,000 years, that there's something in this plant, but they gave it a name. Now, it happened to come from a plant that some botanists called cannabis, as opposed to peach tree or ash tree or red roses. So because they gave the name cannabis, the products were called cannabinoids. Now, watch this. In 1988, they discovered in humans a receptor. In other words, if you took THC, it's stuck into a receptor which we can find now in the human brain. Like, think of it like a baseball mitt. Think of the molecule like a baseball. When you throw the ball, we had a cannabinoid receptor. And then in 1992, we found a second receptor. And then we found that that first receptor lives mainly in the brain. And then we learned that the second receptor lives mainly in the immune system. And then, in 1992, which was yesterday, the same guy who found THC in a lab in Israel found the same molecule in humans. The same molecule. Now, that's why we call them human cannabinoids. We use the cannabinoids because it's the same molecule that we find in the cannabis plant, and we call them cannabinoids because some botanists call the plant cannabis. So, you look at these two molecules. The plant molecule is on the right, and the human molecule is down below on the right. Apart from a little missing piece, they're the same molecule. They fit into the same glove. In other words, big gloves take big balls. Funny-looking deformed gloves take funny-looking deformed molecules. But this, now we know what THC does. It takes the space from the glove that normally a normal molecule should be taking. Now, we talked about, we are now moving to molecular medicine. Forget about the left kneecap and the right upper lobe of the lung and, the left earlobe. It's a molecular world now. And we're talking about molecules. So if you take THC, it will hijack the receptor that your own endocannabinoid is trying to get into, and you become psychically a little bit deranged. So there they are. There the molecules are. They fit the same glove. There's a little minor thing, but they're actually the same organ. Now we're talking about psychoactive and non-psychoactive cannabinoids. And you'll see I put a little red arrow there on the left bottom. THC is the psychoactive cannabinoid. This is why the kids smoke it to get high. This is what happens when you take it by mouth or by smoking, and you feel high and a bit deranged and a bit headachy or a bit... But on the other side is a drug called CBD, cannabidiol. There are others in the formula here, but these are the main ones. Now, CBD is not psychoactive. THC is psychoactive. It hijacks the human anandamide receptor. It takes over the receptor. Because it's got a longer life than anandamide, it hangs around too long. So while your own anandamide is trying to find its way into its own receptor, it degrades, and this is still hanging in there, making this psychoactive thing go on longer and longer. It impairs judgment, THC. In Washington State, where they have now legalized marijuana, in that state, there's been a 20% increase in accidents, road accidents, relating to THC. and it harms the adolescent's brain. Well, we have $1 billion marijuana industry in this country. In fact, the marijuana industry in British Columbia, the gray market, not the legal market, the gray market, is considered to be the same size as our forestry industry. Get your mind around that. So it exists already. We're not inventing something. This is here already. And so Trudeau's desire to legalize it, I'm number one in support of that. Because we're going to legalize a gray market and make it white, and we're going to bring in drug regulations, we're going to bring in pharmacy controls, we're going to bring in quality control and research. And our research is delayed because research into these products has been denied at the Human Ethics Committee level because the Human Ethics won't give permission to use an illegal product. So we're way behind in our research. So the sooner it's all legalized in Canada, it's going to put us in a unique place in the world. We're going to have a federal government approving this thing. This gray market will become a white market. We're not going to create a new market. It already exists, as much as our tree and forest industry. So watch this. I'm going to take you down the value of CBD. Now you'll understand where the real revolution is going to happen. It's going to happen because the money's in THC. THC is what makes you crazed. It's the addictive process. It's making you feel high. But the miracle is going to emerge in CBD. CBD is not psychoactive. It does not hijack the baseball mitt. What it does do is it pumps other normal endocannabinoids. It facilitates them to get in. It grows more natural cannabinoids and pushes them into your own receptor. So your own mechanism is working well. It does not impair judgment. It has no toxic side effects. None. It is the best anti-inflammatory we know without side effects. It has an anti-anxiety effect. It has some pain relief. It has some sleep benefits. But research is needed. Now, in America, you all know the story of Charlotte. Do you know the story of Charlotte? Google Charlotte CBD. And the most amazing story will pop up. This little girl, Charlotte, had continuous epilepsy. She convulsed 50 minutes out of every 60 minutes around the clock. It was hard to feed her. Her mother didn't know what to do. All the doctors gave all these prescriptions, and the mother self-medicated her daughter with CBD. Epilepsy stopped. Now, there are clinical trials going ahead that are supporting and reinforcing that. CBD now is becoming recommended as the drug of choice for pediatric epilepsy. Get your mind around that. I want you to Google something else. Google Parkinson's marijuana. And go to the video section. And you'll see a video of a British guy who has extremely advanced Parkinson's disease. He's doing this constantly. Then he self-medicates with marijuana. What he's doing is he's taking 50-50 THC, CBD. So we don't quite know what it is. But you've got to see this movie. You've got to see it. Google Parkinson's marijuana, and then pick the video, and you'll see this British guy shaking his hands like this. He self-medicates. Within 20 minutes, his hands are motionless, and he's speaking clearly. You have to see it. If you don't believe it, look for yourself. It's on the internet. You can smoke marijuana or CBD. You can take it through an inhaler. You can take it by mouth. You can take it through an anal suppository, or you can put it in through the skin. These are research questions that we don't know anything about in terms of what's the best. We do not advocate smoking. You have 5 times the incidence of lung cancer from smoking marijuana than you have by smoking cigarettes. So we do not recommend that. The inhalers have a problem because when you heat the product, you change the chemistry. They're developing lozenges that will absorb in the mouth. We have no research evidence as to how it works. If you take it by mouth, which is the safest way to do, you get involved in the stomach juices that dissolve it. Not only that, but stomach juices have to go up through the liver where it gets metabolized. So we call it first pass. So a percentage of your first pass gets metabolized right away. If you take it as a rectal suppository, the rectal blood supply is different from the stomach blood supply, and it gets absorbed into the system. So it's probably the best way to give it is that way. But we don't, it's a good point. Thank you for bringing it up. This is where we need research. And we have absolutely no idea. There's no publications out there on the pharmacokinetics of these products. We have $1 billion industry, and we have no research to support these things. Now, we know about the pharmacokinetics of penicillin. You take 4 times a day, 7 days. We know how it works. We know what it's targeted for. So we don't know. Here's the other thing. We don't even know yet. We don't have a lab yet to measure your endocannabinoids. Now, if you have a thyroid abnormality, we send you to the lab. The lab sends back a thyroid blood test. And based on that blood test, we give you a little bit or a lot of thyroid medication. And we know from thyroid studies that you do that once a day. That's the way it works with thyroid. But we are adding billions of dollars of self-administrated cannabinoids into our human systems, and we don't know what our natural endocannabinoids are. We don't have such a lab. I can't send you to the cannabinoid lab. We would like to create one here in Kelowna, and we're working towards that. We want to measure your cannabinoids so that we know what we're giving to you before you start. So when we write these prescriptions, or when you take it by yourself, you're giving yourself agents into your own endocannabinoid system, and we have no idea how it works or what your needs are. Some people need a lot of thyroid, some people need a little bit of thyroid, some people need no thyroid. We don't know these things. Now, my personal practice is I do not prescribe THC because chronic pain is psychoactively active enough. So why add THC to that mix? But CBD is safe, and I'm not going to tell you about my experiences because it hasn't yet been research tested with any vigor, but I have, I'm interested in this product. And I'm interested in seeing research done for this product. And I'm interested in seeing us develop an endocannabinoid lab, so when you come in, we measure your cannabinoids. And believe it or not, we can measure it in your saliva. We don't even need to take a blood test. So it would require a simple saliva test, and we would know what your endocannabinoid profiles are. Like the thyroid patient, we would know what to give and how much of what. You see, 20% of people have chronic pain in the population. That's a lot of people. But 80% of people don't. And what is it that prevents them from having pain? You get it. It's the endocannabinoid system working with your endorphin, endomorphine systems that help us not have pain. So if we understood more about normal people around the normal endocannabinoids and the normal endomorphines, then we would understand how to manipulate added plant cannabinoids to bring your balance to the correct amount. So we're at the forefront of a massively interesting story. We're talking about $1 billion industry that's been here for a long time. Trudeau's not going to grow the industry. It's already growing. But you, the consumers, are going to be gifted this world because it's going to become legal. We're going to get research happening. We're going to find out what it is. We're going to measure your endocannabinoids like we can measure your thyroid. We're going to get there. And I'm excited to be part of it. And I'm excited that you're all going to be part of it too.